Hello, everyone. My name is Omero Salinas, and for this week's discussion post, I will be covering an OBGYN case. And I will begin with Miss EF. Those are her initials. She's a 28-year-old Hispanic female. Her date of birth is 2/25/93. She comes into the clinic stating that she has had very foul smelling discharge from the vaginal area for the past 2 weeks. Miss EF is a 20-year-old female presented to the clinic with the history of a bad smelling thick white discharge from the vaginal area for the past 2 weeks. The discharge is heavier mostly in the morning and especially during intercourse. She's at the moment she states that there's no relieving factors. Her social history: she lives with her husband, has one child, and is currently married. She does not work and denies any smoking or exposure to secondhand smoke. She denies having any other sexual partners at the moment. She states she does not always use condoms or protective barriers during intercourse, but she understands that she must use um, uh, protection during intercourse, especially when she's having these kinds of physical symptoms. She has no previous medical history, but she didn't undergo a C-section in 2012. She also states she tested positive for gonorrhea in 2006, but since then has been cleared. No current drug allergies or food allergies. Immunization, she's up to date. She receives the yearly vaccine. Family history, both parents are deceased, but she states both parents suffer from hypertension and hyperlipidemia. Diet and exercise, she says she tries to eat. She follows a healthy diet and exercises about twice a week for about 30 to 45 minutes per session. Pregnancy history, gravid one, power one. Her menstrual cycle, she says she gets her menstrual cycle every 4 weeks or every 28 days, so on a regular basis, pretty regular. Um, her blood flow her menstrual flow is regular, and it's usually heavy for the beginning for the first 5 days. She denies any spotting or bleeding after her period is complete. Her last pap smear was done 1 year ago, and she states she has not had a previous mammogram. Review of systems. She denies any headaches, neck pain, abdominal pain, no ringing in the ears, no problem with the vision. She denies any pelvic cramping, muscle pain or weakness, any dysuria, no bowel bladder changes in her, uh, no changes to her bowel or bladder habits, no unusual vaginal pain or burning, only during intercourse. Denies any breast tenderness, no nipple hardening or nausea or vomiting. Denies any pain or numbness to her body. Also denies any cough or congestion. Her current medication, she does state she takes Tylenol over the counter, 325 milligrams, 2 tabs every 8 hours as needed, because it can be somewhat uncomfortable for her, as she states, and she says that Tylenol does alleviate some of the discomfort momentarily. Vital signs: blood pressure 124/65 to left arm sitting position. Pulse is 80, respiration 16, O2 sats 99. She currently weighs 146 pounds. She stands at 62 inches tall, and her BMI is 26.7. Physical exam: her head is normocephalic, eyes are clear, her conjunctivas are clear, denies any eye pain, no tinnitus, no abnormalities to the ears, no discharge to her eyes and ears, thyroid is not enlarged, her skin there's no rashes, lungs are clear to auscultation, to all lung fields, cervical and axillary lymph nodes are not palpable, breasts not tender, denies any abdominal discomfort upon palpation. Bowel sounds are active to all four quadrants. Pelvic exam: external genitalia is pink, vaginal walls are pink, cervix intact, uterus is smooth and with the normal limits, thick, noticeable white, thick foul smelling discharge observed in vaginal canal. Lower pelvic tenderness and ovaries are not palpable. To conclude the assessment, vaginal examination indicates a thick gray water discharge with a noticeable foul smell. A urine dipstick was done and it tested negative, but a whiff test was also performed, and it was performed. It was concluded that she did come up. She's positive for Klusel's test. Her pH is 5.5, which is considered acidic. At this moment, I will conclude my primary diagnosis as bacterial vaginosis. My differential diagnoses include vaginal candidiasis, and I also included trichomoniasis as my second differential diagnosis because she is having unprotected sex, and the husband would also would be included in her follow up plan because he must also be tested for it for sexually transmitted diseases as well. Diagnostic plan, we would do since we did a whiff test, it tested positive. I would immediately start her on antibiotic therapy, and I would include flagyl 500 milligrams BID for 1 week to treat bacterial vaginosis. I would also recommend the use of lactobacillus over the counter to balance out her pH of vaginal content. Um, I would also I would also encourage her to avoid acidic foods. Any spices, avoid spices, citrus foods, anything that would alter her pH balance. I would like to see her in 2 weeks, especially if her symptoms do not subside. I would advise her for us to follow up with the clinic if the discharge becomes worse or if there's any blood in the discharge, and we will perform the 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 same tests again until we have a negative result. And I would advise her to again use protective barriers, use a condom or female condom if possible during intercourse, and also advise her husband to also get treated if he is having any um, any foul smelling discharge from his genital areas. And that will conclude the video.